This video lecture is intended for use in PSY 101 General Psychology at Jefferson College. Students should read the accompanying textbook chapter using the provided learning guides to begin note-taking prior to viewing the video. The video lecture should then be used to enrich notes and the encoding of information. This video goes along with the textbook Chapter 15, The Treatment of Psychological Disorders. We will be covering the second part of the Insight Therapies in this video. This video will finish the Insight Therapies learning objectives. As a reminder, there are three different types of psychotherapy discussed in this chapter: Insight Therapies, Behavioral Therapies, and Biomedical Therapies. We will conclude the Insight Therapy lecture. So far, we have discussed psychoanalysis, client-centered therapies, and group therapy. We will conclude with a discussion of family therapy, and then an overall discussion of the pros and cons and strengths and weaknesses of the Insight Therapies. The last category of Insight Therapies are family-based therapies. These therapies can involve a couple. These are referred to as couples or marital therapy, or they can involve an entire family unit. In couples or marital therapy, both partners are treated, and the focus is on relationship issues. The goal is to improve the relationship. In family therapy, the entire family unit is treated as a whole. Occasionally, individual members are also involved in therapy individually. The focus of family therapy is on improving the dynamics in the family and communication. In trying to determine if Insight Therapies are effective or not, we run into a couple of difficulties in terms of measuring to see if they work. One of these difficulties is something called spontaneous remission. This is when people get better without any form of therapy. And so in determining if the therapy works, what we have to do is make sure that more people get better who are in therapy than who are not in therapy get better. The problem with this is we would have to have two groups of people, one group of people in therapy and another group of people that is specifically prohibited from being in therapy. As you can imagine, there are some ethical issues with this. So in terms of determining effectiveness, it becomes a little bit more complicated. Another problem is with psychological issues, how do you decide if somebody is better or not? With a broken bone, you can take x-rays and you have clear, relatively objective data to show that the bone is healed. Or an infection, you can detect levels of white blood cells and determine if the infection has been resolved or not. With psychological issues, deciding if something has been effective or successful or if there's been improvement is a little bit more difficult and involves some subjective opinions. The other problem we run into in determining if Insight Therapies are successful or not is that they're used with such a wide variety of problems. So if you have a person with a mild issue related to some stressor, are you going to treat them equivalent to somebody with a severe mental illness such as schizophrenia? So due to these problems, it's difficult to draw firm conclusions. What we are able to say after many, many years of research is that Insight Therapies are better than no treatment. So when we look at people who are in treatment versus people who are not in treatment, more people get better faster in treatment versus those not in treatment. That means that we're not seeing simply spontaneous remission in the form of improvements in therapy. We've also found that being in therapy produces a durable change or effect that sticks with people over time. Generally speaking, about half of the people in Insight Therapy will have improvement maybe not completely better, but improvement after 20 sessions. And we see that that improvement continues for many people beyond 20 sessions. Insight therapies are usually long-term therapies. It takes time to develop the kinds of relationships you need for these types of therapies to be effective. And so they are therapies that occur over a longer period of time. As you can see from this chart in your textbook, most people are starting to feel better relatively quickly. If you see the steep curve from the first session all the way to the 10th session, and then most people continue to experience gradual improvement over time. However, insight therapies are not effective for everyone. This concludes the Insight Therapy video lecture.